Welcome to Have You Read It, the channel where we bring books to life, one summary at a time. Today, we're diving into Bill Gates's How to Prevent the Next Pandemic. Published in 2022, this book isn't just a timely response to COVID-19, it's a proactive guide to safeguarding humanity from future pandemics. Gates doesn't just highlight the problems, he offers concrete solutions, combining his tech background with insights from global health experts. Gates's interest in infectious diseases started in 1997 after reading a New York Times article about the staggering number of child deaths from diarrhea. This led him down a research rabbit hole, culminating in a 2015 TED Talk and a paper in the New England Journal of Medicine warning about the world's lack of pandemic preparedness. He even recounts a working dinner in February 2020 where he realized the devastating global potential of COVID-19. It was during this time, and the subsequent years fighting COVID-19, that he formed the ideas detailed in his book. Gates identifies a startling truth. While we prepare extensively for fires, earthquakes, and even wars, we haven't prepared adequately for pandemics, which are a greater risk than any of these. One of the first lessons Gates emphasizes is learning from COVID-19. He points to countries like Vietnam, Australia, New Zealand, and South Korea, which successfully managed early waves through rapid testing, isolation, and robust border controls. He also explains the concept of excess mortality as the truest measure of a pandemic's impact, including deaths indirectly caused by the pandemic. Gates highlights failures in the U.S. response, especially the lack of a centralized testing system and slow results turnaround. He contrasts this with the heroic efforts of frontline workers and scientists across the globe, individuals like Shilpa Shri A.S. in India, Thabang Seleke in South Africa, Sikander Bizenjo in Pakistan, and Ethel Branch of the Navajo Nation. He acknowledges the public's struggle with frequently changing scientific guidance, using mask mandates as an example, but emphasizes that rapid, imperfect action is preferable to inaction during a pandemic. He uses the example of David Sencer, a CDC director fired for a swine flu vaccination campaign that, while associated with a rare side effect, may have prevented a much larger catastrophe. A core argument of the book revolves around creating a dedicated pandemic prevention team, much like a global fire department. Gates proposes GERM, a WHO-managed team of about 3,000 full-time experts in epidemiology, genetics, drug development, data systems, diplomacy, logistics, modeling, and communications. This team would monitor outbreaks, raise alarms, coordinate responses, standardize training, and, crucially, run simulations or germ games. He emphasizes the importance of strong health systems, particularly in low-income countries, as a crucial component of pandemic preparedness. The book then explores the crucial role of early detection. Gates stresses the need for improved disease surveillance, both passive and active. He points out that many low- and middle-income countries lack comprehensive birth and death records, which makes accurately assessing outbreaks difficult. He discusses innovative approaches like wastewater testing and the minimally invasive autopsy developed by the CHAMPS network. Gates also discusses how inaccurate early estimates led to flawed conclusions about COVID's transmissibility in children, ultimately shaping school closure policies. He stresses the importance of accurate data to inform non-pharmaceutical interventions and the need for layered prevention strategies in schools. Gates championed the Seattle Flu Study, a project that sequenced thousands of flu genomes and built a citywide flu map. This system, he explains, proved instrumental in identifying early COVID cases in Washington state and exposing deficiencies in the existing testing system. This study also demonstrated the importance of genetic sequencing in understanding how viruses spread through a population. The book details the importance of non-pharmaceutical interventions, like masks, social distancing, and lockdowns in the early stages of an outbreak, while acknowledging their economic and social costs. He stresses the importance of acting early and decisively, even if it seems like an overreaction, pointing out that cities and countries that implemented strict NPIs early on fared much better. He cites a study that tracked mobility data through cell phones to demonstrate that lower-income communities were less able to comply with lockdown orders due to the nature of their jobs. Gates discusses the nearly complete disappearance of flu during the first year of COVID, attributing it to widespread NPIs. This, he argues, is evidence that similar measures can be effective against future outbreaks, and suggests the eradication of entire flu strains as a long-term goal. He explains how contact tracing, though challenging, proved effective in countries with strong public health infrastructure like South Korea and Vietnam, and points out the need to identify and target super spreaders. Gates breaks down the science of airborne transmission, explaining the role of droplets and aerosols, and emphasizes the importance of good ventilation in mitigating spread. He argues for the continued use of masks, particularly high-quality respirators, citing their low cost and high effectiveness in reducing transmission. Turning to therapeutics, Gates explains the difference between small molecule drugs and large molecule drugs. He expresses disappointment in the slow development of effective COVID treatments and explains the limitations of options like hydroxychloroquine, remdesivir, and monoclonal antibodies, while highlighting the success of dexamethasone in treating severe cases. He discusses the challenges of drug development, from preclinical studies to clinical trials, and advocates for standardizing trial protocols and using technologies like high-throughput screening to accelerate the process. He also details efforts by the African Medical Supplies Platform and UNICEF to make dexamethasone available in developing countries. He discusses the importance of generic drug manufacturers in making treatments affordable, pointing out that tiered pricing models have been effective in bringing HIV drugs to low-income countries. He also emphasizes the need for oxygen therapy and ventilators, particularly in developing countries where access is limited. He concludes that research should focus on developing pan-family or broad-spectrum therapies effective against entire families of viruses. Vaccines are a central focus. Gates celebrates the unprecedented speed of COVID vaccine development, noting it as a miracle given the typically low success rate and long timeline for vaccine approval. He details the challenges of vaccine development and manufacturing, pointing to the complexity of the products and rigorous testing requirements. Gates discusses the importance of mRNA vaccines, crediting Katalin Karikó and Drew Weissman's pioneering work and explaining the technology's ability to rapidly adapt to new viruses. He highlights the role of mRNA vaccines in achieving widespread vaccination and discusses the potential for developing universal vaccines for coronaviruses and influenza. He contrasts mRNA vaccines with other types like viral vectored and protein subunit vaccines. Gates stresses the need for global cooperation and funding for vaccine development and distribution, arguing that market forces alone won't suffice. He explains that COVAX, while imperfect, represents the largest vaccine distribution effort to developing countries ever. He critiques the focus on waiving intellectual property rights, arguing that it wouldn't significantly increase vaccine production and could lead to quality and safety issues. Instead, he advocates for second sourcing, where companies share their technology and expertise to increase production, pointing to the Serum Institute of India's success in producing COVID vaccines. Gates discusses the importance of Gavi in financing vaccines for developing countries, highlighting its role in building supply chains and increasing demand. He contrasts the rapid vaccine rollout in countries with existing strong immunization programs, like India, with the inequitable distribution that prioritized low-risk individuals in wealthy countries over high-risk individuals in poorer countries. He emphasizes the challenges of vaccine delivery, especially maintaining the cold chain in remote areas. He looks ahead to innovations like micro-needle patches and infection-blocking drugs that can be inhaled or ingested,